over 70% of adults age 65 and up have some form of periodontal disease. People with gum disease have 2 to 3 times higher risk of heart attack or stroke. We're finding bacteria that's usually found in the mouth, P. gingivalis bacteria, that's found in the brain tissue of Alzheimer's patients. Seniors with chronic periodontitis are 70% more likely to develop dementia.
There's not enough discussion about preventative care. It's all just treating what's happening. But if we can learn how to prevent things before it actually happens, that's so much better for us. Welcome back here to Spotlight. I have a wonderful guest here, Sarah Udaruju. I knew I'd mess it up. I'm trying to get it right. But Sarah is here representing BU Dental, and this is a really important area for senior care, senior health. There's just so much that goes into dental that I don't think as younger or more mature adults, we don't really think about this and how it can impact our seniors. And so it's really important to have this conversation today. Just get educated on the topic, learn about how this impacts our health, our seniors' health, whether that's our parents, our loved ones, someone we're taking care of, or you yourself. So really excited to have our guest speaker today. So Rod, do you want to tell us a little bit about you and how you got into this industry?
Sure. So I am originally from the East Coast. I'm from Jersey. That's where I went to dental school at Rutgers. And my partner and I we started this practice about 2 years ago. And she and I both went to dental school together, and that's how we knew each other. And so
Awesome.
my wife wanted to move back out here to the West Coast, and so I reached out to my friend and kind of to set up shop. So it's been 2 years. As far as my personal journey to dentistry, um, I had a terrible experience as a dentist, as a kid with the dentist, and I think it's kind of shaped how I see dentistry. In my personal approach and my partner's approach, our practice has always been to try to do things more on the prevention side of dentistry. How can we do more by doing less, essentially?
Yeah.
So that's kind of where we're positioning the practice to empower patients to be more prevention focused and
Mhm.
try to get them to not only have great oral health but also great systemic health. And we'll talk about kind of the links between oral health and systemic health hopefully later on today.
Yeah, I love that. For one, I think just overall in the healthcare industry or medical industry, there's not enough discussion about preventative care. It's all just treating what's happening. But if we can learn how to prevent things before it actually happens, that's so much better for us, better for our health. It's more cost effective. It helps us in the long term. So I love that you guys are doing that. And also your backstory about I was a child and this impacted me and I wanted to make a difference. I can recall a scary situation when my youngest son was 2 and he had chipped his front teeth so low that the nerve was exposed and he had to have them pulled because it created an abscess and he couldn't go under because he was too little and he didn't want to have the gas mask on. He was just freaked out about it. So it overall ended up being a terrible experience. We had to hold him down with his teeth getting pulled
Wow.
out, and I don't know how much of the gas he got. And so it was just
Yeah.
such a scary experience, and it traumatized him for so many years. And so just knowing that you went through something that really impacted you and you want to make a difference, I love that. But I'm wondering too, how did you get to like working with seniors? Because I understand that you work with all ages, right?
Yes. Yeah. So, I mean, we're not exclusively focused on seniors, but we feel that our prevention-based oral systemic approach to care is really beneficial for older adults.
Hmm.
We are looking to prioritize preserving natural teeth, managing chronic conditions through better oral health. There's so much new technology coming these days that we're able to catch things a lot earlier.
Good.
We feel really that this approach kind of aligns well with the needs of seniors looking to stay healthy and independent for longer.
I love that. And you started to actually go into some of the questions that I was going to ask you about. So what is I know there's different types of tools and there's new things that we can start using to support our seniors as they're aging. There's even different situations where sometimes dentistry needs to be a little more accessible for our seniors because they're not as mobile. So I know there's so many different technology pieces that help with our seniors and taking care of their oral health. Can you go into a little bit of what it is that you use specifically to help seniors to aid in their dental needs and their health care with their oral
Sure. Yeah. So,
hygiene?
obviously, one of the things I feel like, as seniors get older, it's harder for them to make it to the dental office. So, one of the great things about our practice and what my partner has done is she actually has, prior to coming in to this practice, her other secondary business was mobile dental care. So I
Mm.
will actually go out to people's houses for emergencies and look at seniors. And we now have the capability to take X-rays wherever we need. We just have like this mobile X-ray unit, so we can take X-rays wherever we need to go to. So it's easy for us to at least triage and figure out, hey, what are the things that need to be done. And now with the technology that's coming out, I mean, you can take 3D scans of people's teeth, and how with all of this, AI development and everything, it's becoming so much easier for us to provide care for patients. Where if something breaks or if their denture breaks, we have a copy of their denture, and we can just tell the lab, "Hey, can we fabricate a new denture?" And within a day, we basically have a turnaround of a new denture for the patient, something like that.
Wow, that's quick. I love that. I
So
know
that's more, I guess, on
the mobile side
yeah.
and
So that's more like the treatment side.
okay.
As far as more of the prevention side that we are looking to do more, one of the big things I feel like that we particularly here do at our practice that has not yet caught on. I feel like as time progresses, I feel like more and more dental offices will do this. But we do bacterial testing on site. So one of the
Wow.
biggest things is we're trying to get an idea of a patient's risk factor based off of their bacterial profile. And so it's an easy way, it's a cost effective. Essentially, I'm just paying for slides, and I can take a quick plaque sample, put it on a slide, and then we can look at the bacteria together and say, hey, you're low risk. We're actually doing everything really good. So keep up what you're doing. Or, hey, high risk. Look at all this bacteria. And then let's talk about what are the things that we can kind of improve. And the really nice thing with doing that here at the office that we found with our patients is, seeing is believing, right? So when
Yeah.
patients are able to actually see the bacteria that's going on around in their mouth, they're a lot more inclined to be like, oh my god, that's gross. What do I do about it? And they are a lot more compelled to change their habits and
Yeah.
implement different strategies. So that's been really, really great to offer for our patients.
I love that. And so for someone who doesn't really know what this means, if you're looking at bacterial um, health, if there is a plethora of bacteria that's not good,
Yeah, yeah,
what could that be a sign of? And then how do we treat something that's typically due to a lot of bacteria,
yeah.
bad bacteria?
So, yeah, that's a great question. I mean, it's we're never going to get to a point where we look at a slide and we see zero bacteria, right?
Yeah.
There's always bacteria. The question is, ideally, we want a nice balance and want more good bacteria and less bad bacteria. That's the ultimate goal, right? So essentially, what we're trying to do is when we look at the plaque sample, we can we can roughly tell, okay, am I seeing more bad bacteria? Is there a lot of activity? And then
Mhm.
based off of that, then we come up with a general plan between first figuring out what they're currently doing with their home care, and then what are the things we can possibly improve with their home care. The last thing that I want to do when patients come in and be like, oh, you have high bacterial risk, we got to do all this and this and this and this. The goal is not to overwhelm patients. The goal is to say, okay, let's start by the base layer. Let's just clean everything up. Let's talk about your home care. What are the things you're currently doing? What are the things you can do at home? And then we can start adding layers as we go up based off of what we're seeing.
What are some of the differences that you have seen from, adulthood to going to geriatric care as far as dentistry goes? What do you start to see as we age in the dentistry field that we should be aware of, as we age? And how can we start to take care of our gums and our teeth now so that as we age, we're in a good place?
Yeah. Yeah. Interesting thing is that if you look at the statistics, over 70% of adults age 65 and up have some form of periodontal disease. And so as we get older, our immune system gets weaker. So
Mhm.
diseases tend to progress much more rapidly in older adults. And so we're looking to see, one of the things is one big thing with seniors is usually that they are trying to manage dry mouth because they have a lot of
Mm.
systemic conditions, they're taking a lot of medications. The usual side effect of a lot of these medications is dry mouth. So one big thing that we try to focus on as far as education goes is, okay, let's talk about what are the different ways we can manage this dry mouth. Obviously, we can't get you to stop your medications, right? So now it's all about management. Do we
Yeah.
we talk about, how is your hydration? Are you drinking a lot of water throughout the day? There's different xylitol products like chewing gum, xylamelts, biotine mouth rinses. So there's a plethora of products available, and it's really just a question of, what works best for that specific patient. So we kind of say, okay, let's try this a variety of things. Which one works for you? And then we figure out how can we figure out how to manage that going forward. So that's one big thing as far as with the senior population and managing dry mouth. Um,
Mhm.
the other big thing with seniors is that there's a whole range of systemic conditions and systemic diseases. It's natural that as patients get older, they are having more systemic conditions like heart disease, diabetes, rheumatoid arthritis, regular arthritis, pneumonia. And so we've found that there's more and more research coming out talking about the fact that there are significant oral bacteria found in all of those systemic conditions. So when you talk
Wow.
about something like heart disease, people with gum disease have 2 to 3 times higher risk of heart attack or stroke. And
Wow.
oral bacteria DNA has been found in 100% of atherosclerotic plaque in some studies. So we know that bacteria is traveling from the mouth to the rest of the body. And so we want to ideally make sure that, we want to keep this healthy because we
Yeah.
know bacteria have a chance to travel elsewhere.
Wow.
Alzheimer's disease is another one. We're finding bacteria that's usually found in the mouth, P. gingivalis bacteria, that's found in the brain tissue of Alzheimer's patients. And seniors with chronic periodontitis are 70% more likely to develop dementia. And so there's so many of these systemic conditions. And, one of the reasons why I really was interested in doing this podcast with you is I feel like it's starting to become more commonplace. Where just this morning I was reading an article on Business Insider about the connection between oral health and systemic health. So it's now
Mhm.
starting to become more commonplace to understand that there's a strong link between oral health and systemic health, and keeping your, like, it's not normal for you to bleed when you're brush.
Right.
People are like, oh, I just bleed a little bit. But,
Yeah.
if you were bleeding on if you got a cut on your hand and you were bleeding, you wouldn't be like, oh, yeah, whatever, it's just blood. People have, for some reason, just felt, oh, it's fine. I just occasionally bleed on the gums. Any amount of bleeding is a sign of inflammation. And that
Mhm.
inflammation is a high risk for all of these crazy bad bacteria to essentially jump into the bloodstream and get into the rest of the body and cause all of these systemic issues. So that's one of the reasons why I do more of this bacterial testing, because it's not just about oral health, it's about systemic health.
That's right. That's really, really amazing that you're bringing all this to light. I mean, I work with seniors every day, and that's not something that, like, our care providers typically start to think about, is how are they managing their dental health, their oral health? Um, are we thinking about bacteria? How can we
Yeah.
prevent this? And especially when it comes like memory care patients or, I don't know what the statistics are, but, dementia, early onset Alzheimer's, early onset dementia, all these things are increasing in number. And we're not really 100% sure why.
Yep.
But here we go. There's this systemic health, and it's, impacted by some of this bacteria, and that is something we really need to pay more attention to. We're not talking about this enough. And it sounds like from the readings that you're doing, it is starting to come to light, but we need to have more and more of these conversations and more education
Absolutely.
circling around our communities, around our young adults, our seniors themselves, so that we have an awareness on what is happening, why it's happening, more preventative care is taken. And we're just overall, we're being healthier and more cognitive of what we can do and should do for ourselves. Are there things that we can do? Obviously, regular dental checkups. Well, I guess we could start with there. How frequent should we be seeing our dentist? And does it change if we have somebody that might be in like memory care? Does it change if a senior is in a senior living community versus at home? Or is it always consistent? No, we should be seeing our dentist um, X amount of times a year. And this is what we should be looking at, or the different types of services we should be having.
Yeah, no, that's a great question, and um, I think first thing is we need to kind of throw this antiquated model of cleanings every 6 months out the window.
Okay.
The whole 6 month cleanings, I feel like randomly came to be because insurance selected a random metric and said we will cover cleanings every 6 months. It
Wow.
has no bearing on what the patient actually needs. They just say, well, it's every 6 months kind of thing. But the problem is, especially as patients age, there's a lot more systemic factors that we talked about. And those factors usually lead to a higher level of inflammation. And many times these seniors would probably benefit more from more frequent hygiene visits.
Mm.
Preventative care every 3 to 4 months instead of every 6 months goes a long way in reducing the need for reactive dental care. So the goal is we want to catch things much quicker and address them before they become bigger problems.
Mm.
Especially as we get older, I feel like home care just naturally kind of diminishes. It's manual dexterity becomes a problem. So as we get older, it really should be that you should probably be coming to the dentist way more frequently,
Yeah.
especially when you're dealing with more of like the memory care patients. We know that by reducing the plaque and calculus build, tartar buildup, all of these things, we can go a long way in at least hopefully trying to reduce some of the symptoms associated with the dementia and the Alzheimer's, because it's reducing that bacterial profile essentially. So there's no, unfortunately, it's not a cookie cutter answer. It's not like, if you're in this age group, you come in every 6 months. If you're this age group, every 3 to 4 months, right? Every patient is different. And one of the things that we try to focus on is data driven personal care to every patient. So that's where like the bacterial testing comes in. If you come in and we do a plaque test and things look a little crazy, we might say, hey, the regular 6 months I don't think is ideal for you. I really think you should be coming in every 3 to 4 months or something. If everything looks healthy, you'll be like, hey, you're actually doing really good. You have a low bacterial risk profile, but we'll keep you on the 6 months recall schedule. So it kind of depends per patient.
Yeah.
And based off of that, that's how we kind of figured out. But I mean, the one nice thing that insurance did do with this whole every 6 months is at least they've made it commonplace to say, "Oh yeah, I really should go to the dentist. It's been 5 to 6 months." Every patient knows that. Oh man, yeah, it's been overdue. I haven't gone in the past, 8 months, and I should go every 6 months. So at least they planted that seed, which I think is really
Yeah.
helpful because one of the nice things that we have in the dental field that the medical field lacks is on the medical side, they say, "Oh, once a year, go in for your checkup," right?
Yep.
And even that, most patients don't really do. I have plenty of patients that come in like, yeah, I haven't gone for a checkup in like 2, 3 years. But
Mm.
at least they're like, no, no, but it's in their head, ingrained in their head that, oh yeah, I have to go to the dentist. It's been 9 months. I need to go in for a cleaning kind of situation. So at least they made it more common for patients to say, I got to go in for a checkup and a cleaning.
Yeah.
Uh, that 6 month vernacular, unfortunately, we get a lot of patients that say, well, what does insurance cover? And unfortunately, it's not about what insurance covers, it's what's best for you. Sometimes there's a divide between the two things, and that makes things a little bit more difficult.
Yeah, yeah, definitely. And I guess what I am hearing you say too is that at least there was a minimum kind of expectation by insurance, which is great, but we can do more. We should do more, but it's also personalized based on your own health. A question that came to mind was, what if your dentist isn't normally doing like these bacteria kind of scans, if you will, or assessing the bacteria in your mouth? What if this is something we want? Can we request this? Is every dentist capable of doing this? How does that work?
Yeah. So as far as so there's a little bit of a distinction. So the thing that we do here at the practice is bacterial testing. We have microscopes here in the practice, and they're hooked up to monitors, so we can really just do it at a very uh, nominal cost. We actually don't charge for our bacterial testing. It's part of our practice. New patients come in, and it's the X-rays, the pictures, the clinical scan, and bacterial testing. We feel that it's the
That
comprehensive
important?
care to be able
Yeah,
to do all of these things.
yeah.
If you are going to a dentist that obviously does not have the microscope and all of these things, there are services, one of there's salivary testing nowadays that's becoming a little bit more commonplace. The
Okay.
nice thing, I mean, unfortunately, dentistry has always been more of a reactive field, right? We would only treat what we can see.
Right.
And what we see is either on the x-ray or clinically. And the problem with that is by the time you actually see the damage is already done. And at that point, we're really just looking to manage and address the damage.
Yeah.
So ultimately, the goal with the bacterial testing and the salivary testing is going to be, how can we look at a crystal ball of what's going on in your mouth, and before the bacteria has a chance to do all of the damage, how can we address these things? So there's
Yeah.
a bunch of salivary testing companies out there. Oral DNA, there's Bristle, which is actually a direct to consumer salivary testing. I think it's like 150 $170, and it you get like a little vial in the mail. Just take
Hmm.
a saliva sample, put it in there, send it out, and they will give you a test result of all of the different bacteria. I think they check for like 300 bacteria, something like that. And so they will give you an analysis of all of the bacteria. But then the nice thing is it's a little more patient friendly, where it'll tell you the caries, bacteria responsible for decay, you are at a high risk, or the bacteria responsible for bone loss, and all of these things, for bad breath and all of these things. So it gives a nice kind of detailed breakdown. So I think the nice thing about kind of where we're headed is patients are being a lot more educated, and they're looking for care basically on their own, right? You have like the Aura Ring and all of these things to have patients themselves monitor their vitals,
Yeah.
all of these different metrics. And so they are a lot more educated, and they know that they can figure out whatever is, if something's off, because unfortunately, if you're needing to go to the hospital, then it's waiting in line and then going to,
Right.
seeing a doctor. And so these models, I think, are really starting to step up. So
Hmm.
to kind of go back and answer your question, even if your doctor or dentist is not offering some of these things, it might be worth just having a conversation with them and saying, hey, I'd like to get my saliva tested. I'd like to actually see what my risk factors are. And based off of that, we can, ultimately the goal is personalized treatment plan for you based off of your specific risk factors.
I love that. It's so important. I think that most of our audience is probably going to go back to their dentist and start to ask for saliva testing after hearing this. I
Yeah.
know I am. So one of the last questions that I'm wondering about, and I think our audience is also likely to wonder the same thing. In the next, few years, do you see any challenges that our seniors will be facing in regards to the dental industry. Is there technology that'll work for them or against them? Are there regulations that you think are going to make it harder for our seniors to access dental care, or is it even accessibility? Well, I know you talked about mobile dentistry, even in our senior living communities. We have mobile dentistry that we offer as well, because we do want this to be accessible for our residents and we want to make sure they're maintaining their health, and dental health and hygiene. But are there challenges that you foresee coming up that we should be aware of?
Yeah, I mean, I think the biggest thing obviously is we're just seeing rising rates of cognitive decline, and
Yep.
that makes oral hygiene so much harder to manage. We kind of unfortunately leave oral health behind when we're dealing with more of these systemic things, and ultimately the hope with doing more of these kind of conversations is at least educating the patients and saying, no, like this is a big component of all of the other systemic things. We can hopefully minimize the risk for those things and minimize the symptoms for all of those other systemic things by hopefully managing your oral hygiene as well. So putting an equal importance
Mhm.
on oral hygiene, especially as you get older, because of the fact that you are seeing more of these, systemic conditions
Yeah.
rising, and it's just becoming more and more prevalent. And it's normal because the people are living longer, so
Yep.
it's just a question of, okay, how do we make sure that this is an important component of your overall health? And secondly, I would say definitely the affordability gap. Dental care insurance, unfortunately, usually doesn't cover a lot of preventive services. If I would love it to basically take a saliva sample and send it to the lab and have the insurance cover it. Unfortunately, it doesn't, right? So I'm
Right.
hoping that as we do more and more of this stuff, insurance also gets on board because it's a benefit for them too, because it's less costly to do prevention stuff versus having to, deal with periodontal disease and deep cleanings and all of these things,
Absolutely.
cavity fillings and crowns and all these things. So yeah, affordability gap is a big thing. And then finally, yeah, it's really just education, making sure that uh, patients become aware that oral bacteria can impact their heart, their brain, their joints, all of the above, essentially.
Yeah. Well, and education is so critical, right? It's awareness of what can happen to our bodies. How can we take measures to have preventative care and really take care of our overall health and well-being? Which I know at BU Dental, you guys are so amazing at educating your patients, educating the community, which is one of the things I absolutely love about you. You are located in Walnut Creek or Pleasant Hill?
Pleasant Hill.
Pleasant Hill, California, right next to Walnut Creek,
Yeah.
California, Northern California. But BU Dental is all over, I believe, right?
No,
Uh,
no.
oh,
Just
just
yes,
here.
it's
Oh,
BU because my partner is her last name is Batista and my
that's
last name
right.
is Raju, so it's just
Yep,
BU. Yeah,
that's right. So,
yeah.
but the hope is that maybe you will grow to be more, uh,
Maybe.
yeah. I mean, besides being mobile, because you are such great educators. But what would you say to our audience if they had questions about their dental health, wanted to get a hold of you, wanted to see you, wanted to come in and have a, bacteria or saliva scan? If they want to see you and your partner in your practice, how do they get a hold of you?
Yeah. So our website is www.bu-dental.com. Pretty simple. And so our contact information is on there, and you can request a an appointment as a new patient. And
Wonderful.
because we do all of this, our new patient visits are pretty comprehensive. We spend 90 minutes to get to know the patient, because it's not just about data collection, it's reviewing your health history, your dental history, your medications, any surgeries, any family history, your diet, because that's a big component. So it's a pretty long appointment, because we want to make sure that we're connecting all of the dots together to
Mhm.
make sure that we give you the best care possible. So yeah, so the best place to find us would be on our website, and then from there you can absolutely contact our office. And even if you just want to come in for a consult and you're like, hey, what do you think about this? We're more than welcome to have patients come in so we can take a look.
I love that. And then what is the phone number to your office?
Yeah. So the phone number is 925-687-0343.
Okay, awesome. Well, thank you so much, Sarah, for coming in today, for educating us. I know I learned a few things. I'm sure our audience took away a ton of gold from this conversation. We're always here to educate everyone, adult, our adult children, our seniors, our community. We're great community impactors and shakers. And so we hope that you learned a lot. Thank you again, Sarah, for coming.
Thank you so much, Athena.